Assalamu alaikum. My name is Samran War. My roll number is BP1650196 and I am from group number 44. Today the topic of my case study is gout and hyperuricemia. First of all, I have to tell about gout and hyperuricemia. Gout is actually a form of inflammatory arthritis. It is usually due to elevated level of uric acid in the blood, and it can cause by various factors, that is a combination of diet, other health problems, and mainly from genetic factors. If there is a high level of uric acid, it crystallizes and the crystals begin to deposit in joints, tendons, and surrounding tissues, resulting in an attack of gout. Diagnosis of gout may be confirmed by the presence of crystals in the joint fluid or in a deposit outside the joint. Hyperuricemia. As the term indicates, hyper means high or elevated level of uric acid in the blood. There are certain ranges which indicates that the person or the patient is hyperuricemic. If there is 6 mg per dl serum concentration in females, 7 mg per dl serum concentration in men, and 5.5 mg per dl for youth under 18 years of age, it means they are suffering from hyperuricemia. There are certain causes of hyperuricemia and gout. Some of them are discussed here, that is genetics, mainly genetics, insulin resistance, iron overload, hypertension, hypothyroidism, chronic kidney disease, obesity, diet, use of diuretics, and excessive consumption of alcoholic beverages. Comorbid conditions. As the term indicates, comorbidity means more than one disease or condition is present in the same person at the same time. Conditions described as comorbidities are often chronic or long-term conditions. It means that we have two conditions or two diseases in the same patient at the same time. Dyslipidemia. Dyslipidemia is actually an abnormal amount of lipids, example triglycerides, cholesterols, fat phospholipids in the blood. As here a diagram shows a blood vessel which have red blood cells in it, and also there is a deposition of cholesterol which indicates dyslipidemia. Allopurinol. Allopurinol is actually a drug which is usually used to maintain hyperuricemia in patients. Allopurinol, first we have to discuss about the mechanism of action of allopurinol. Allopurinol undergoes metabolism in liver, where it transforms pharmacologically into its active metabolite, which is oxypurinol. Half-life of allopurinol is 1 to 2 hours, and oxypurinol is about 15 hours. Both allopurinol and oxypurinol are renally excreted, that is, they can be eliminated through kidney. Allopurinol and oxypurinol both inhibit xanthine oxidase, which is an enzyme in the purine catabolism pathway, which converts hypoxanthine to xanthine and then to uric acid. Administration of allopurinol is in two forms, that can be oral or intravenous. If there is oral administration, then it is very beneficial because it is a standard route for gout and uric acid or calcium nephrolithiasis. Now we will discuss about the case study of hyperuricemia and gout. A 57-year-old man who presents to his family physician for a regular checkup. He is currently controlled on allopurinol 300 mg per day for the management of hyperuricemia. For his dyslipidemia, takes simvastatin Zecor 40 mg per day. Now here it indicates that the patient is suffering from comorbid condition. Means he has both hyperuricemia and dyslipidemia. Although his low density lipoprotein is at goal of less than 130 mg per dl, he requires further lowering of his non-high density lipoprotein cholesterol less than 160 mg per dl. What would be the best option to consider in this patient? To explain this case study, we have to prepare soap notes. In the soap note, first of all, we have subject, which includes the gender of patient, which is male, age of the patient, which is 57-year-old, and history. His medical condition is hyperuricemia and dyslipidemia, which is controlled by taking allopurinol and simvastatin. Object, By the diagnostic condition, it is estimated that he is suffering from hyperuricemia and dyslipidemia. Assessment. We can manage this condition by changing lifestyle and by taking fibrates or niacin are effective in lowering total cholesterol, LDL, and triglycerides. A fibrate or niacin can also be used in combination with the patient's current Simvastatin. However, with a history of gout and hyperuricemia, a fibrate would be preferred over niacin. It means that if patient is suffering from gout and hyperuricemia both, then a fibrate is more preferable than niacin. Femofibrate has been shown to decrease uric acid serum concentration and could be beneficial in this dyslipidemic patient with a history of gout. Plan. In plan, we have to mention both drugs, niacin and fenofibrate. Niacin, which is actually vitamin B3, exists in two forms, nicotinamide and nicotinic acid. The recommended daily allowance of vitamin B3 for nutritional benefits is only 20 to 30 mg per day. But if we are taking niacin or vitamin B3 for lipid benefits, that if we are taking for the management of a disease which is hyperuricemia and uric acid, then we have to consider that if it is in immediate release form or extended release form. If it is in immediate release form, then we have to administer 3000 to 6000 mg per day. Or if it is an extended release form, then we have to administer 1000 to 2000 mg per day. However, if we talk about fenofibrate, which is more preferable over niacin, we give fenofibrate 150 mg per day. Thank you.